Good afternoon. I'm Chandra Luckett, Chief Marketing Officer here at Chris 180, and we thank you for joining us for our Lunchtime Live series. Recovery, it's a process that is a part of every community, and many families across the country and right here in Metro Atlanta face these conversations every single day. September is National Recovery Month, a time when we highlight and celebrate those who are on the recovery journey. And with this year's theme of recovery is for everyone, today we'll highlight how the recovery journey impacts all members of every family who are struggling with recovery and addiction to substance use. Today, our panelists include two leaders from our Chris 180 recovery programs. We have Jen Acker, who is the project director of the Chris 180 Treehouse program, and Chris Haider-Bardill, who is the project manager of our Hero project. Please enjoy this conversation. Chime in. We want to know your thoughts, your feedback, your questions, and concerns you may have about the recovery journey. We'd love to hear from you, so join us by using the chat feature to ask questions. And Jen and Chris, I'll kick it over to you.
Thank you, Chandra. So, Jen, this has been a wonderful month to talk, you and to plan our recovery fair. One of the things I know we wanted to start out talking about was what are some of the myths that have really persisted when we talk about addiction and recovery.
Mm-hmm. I think just right there, you unknowingly spoke into a myth. The recovery world's language is changing from a term and a stigma associated with addiction and that language to focus more on a substance use or a substance use disorder. In the past, there's been a big stigma around addiction and people who use substances to cope with their life and their struggles that they're going through. So the recovery community is shifting focus from that mindset that it's addiction, it's a bad word, it's a yucky, scary process to more of an understanding of the biology and the chemistry that goes into a substance use disorder. And shifting from that, if you use, it is bad, to a spectrum approach of a mild, moderate, and severe substance use disorder and the challenges and struggles and consequences that come along with using.
Jen, I really appreciate the reframe. I know this is something I continue to work on to adjust my own language. I have worked my way out of using the word addict because I know the connotations that bring and have been very practiced in making sure that my language is person first. So there is a person with substance use disorder. In this case, I really do actually appreciate the reframe because I do feel like this is something that we have to practice. A lot of these words have been repeated for so long, and we've heard them since, in my case, I can remember hearing some of the terms that I no longer use since I was a kid. But I think it is hugely important to work our way out of the stigma and to continue to see people before anything else.
Yeah, I'm really excited to have this opportunity to talk about the myths of substance use, what treatment can look like and how it's different for every person, family, or community that's impacted by someone's struggle with substance use. And then to highlight and celebrate the hard work that is recovery and what that can look like and how individualized that is. Again, to move away from this one size fits all mentality into and celebrate the broadness and the uniqueness that is all people and humanity, which is something that we really work hard to do at the Treehouse program.
Absolutely. And I know recovery can look different for different individuals, for different families, for different communities. And I know we're still busting some myths. Mm-hmm. So you mentioned some of the brain chemistry. And I think talking about substance use disorder as a brain disease, as what it actually is a huge distinction. And I remember having conversations many times in the past with those that would see substance use as a moral issue or a choice.
Right.
And so that's something that I think is very important for us to continue to break apart and really to remove the stigma. This isn't a choice. This isn't a moral failing. This is a brain disease.
Yeah. To think it's meant now, I would like to take an opportunity to introduce the Treehouse and the program, the treatment that we provide, because it plays very much so into this shift in mentality and breaking the myths and stigmas, which is what we strive to do every day at the Treehouse. So the Treehouse is a 5-year federal grant awarded through SAMHSA, or the Substance Abuse and Mental Health Service Administration. We are moving into year 4 of our grant, so we have about 2 more years. What's so unique about this program is that it is no cost to the community because we are fully funded through SAMHSA. There are some, qualifiers or stipulations. We serve ages 13 through 24, and our clients must be a Georgia resident and have a Georgia address. With the Treehouse, we have 2 different levels of care. We have an early intervention program that is comprised of 1 weekly group as well as individual and family therapy. And then we have our intensive outpatient program, which is 9 hours of group therapy plus individual and family therapy. And then the entire program has access to a case manager, peer support specialist, a family support group, family and parent training, a psychiatrist, and medical oversight. So we really are an all-encompassing, a wraparound program so that we can address the unique needs of our clients, especially with our clients being so young, which is another myth about substance use disorder, that it only impacts older adults, that by the time it's an addiction, it is a full-grown adult, when substance use disorder can affect even young people. We start serving at age 13, and we even see some of our clients have started using and experimenting before age 13. And the reality of substance use disorder is that it can affect anybody, any age, any race, any demographic, socioeconomical status. Substance use disorder, it's not prejudice because it's biology, because it's chemistry. And we are all human beings, and so we all have the same biology and chemistry going on in our bodies.
Absolutely. So I love hearing about the Treehouse program and all of the wonderful supports that you and the program can bring to bear. It's amazing. And to hear that it comes at no cost to the consumer, to the community, is phenomenal. I know, looking at my program, at the Hero program, one of the best things that I can say about that is we thankfully are also a no-cost service. That right there breaks down so many barriers and allows those who may not be able to receive support in the way that we can provide, they can get that support now. So the Hero program is a great program that I'm so happy to be a part of. We're a community program though. So we actually meet our clients, our families out where they are. And in particular, we are here to serve those impacted by opioid use disorder or other substance use disorder. Our goal is to really break a cycle. It is to intervene and prevent future substance use with children. And we work with children as young as newborns, as young as 0, and go all the way up to 18. And we are always working with the families or the caregivers that are around this child or children, because they are always going to come with grown-ups. For our program in particular, we do have a lot of caregivers that may be grandparents and children that may have lost a parent to substance use. So we work to provide levels of support using a wraparound model as well, where we have a licensed therapist that can really dive into the trauma that exists at multiple levels throughout this family unit, throughout the child and their life and their development. And we have a care coordinator who is there to support the family, to provide resources, and to build some of the skills that we know are going to build resiliency. And that's really what it's about. We are looking at children. Children are always going to be vulnerable, and one of my professional and personal goals is to protect children. And so I want to build that resiliency as much as I possibly can. And I'm so glad to be a part of Chris 180 and to be able to connect with you and the Treehouse program.
Yeah. I think that's what's so unique and important about our programs is that it's just not focused on the substance user, but the community and the support around. I think so many people who struggle with substances and have a substance use disorder think they're alone, or that their family has forgotten about them or doesn't love them anymore because of their substance use. And that's another myth. Personally, as a family member of people who struggle with substances and have a substance use disorder, that can't be farther from the truth. That I love my family, want to support them in opportunities for health and wellness and growth, but I am not willing to support them in behaviors that would lead to illness and hurt and pain, which is something that I think our programs do so well, is addressing that family recovery piece, that support system piece. In both Hero and Treehouse, I wish they existed when I was a kid, struggling to understand what was going on in my family. I think that is what is such a benefit and a resource to our community that these programs exist.
Absolutely. And I mean, Jen, thank you so much for sharing your story. I know how personal and impactful that is to you, and sharing it is another way that we break down some of these barriers. It's, I think you said before, we are trying to show the reality, not a perspective, not an idea, but the actual reality. And we are trying to build upon that. I think we might have actually had a question.
We do. Norma on Facebook asks, how do you both recommend talking to someone in our lives who appears to be struggling with substance use, but who hasn't expressed interest in treatment?
That's a great question. And because of the way substance use interacts with the brain, I'll get a little nerdy here. Substance use works on a person's pleasure pathway. And so one of those neurochemicals in our brain is dopamine. And when a substance, for instance, alcohol, marijuana, opiates, caffeine, sugar, are all substances. When those enter the brain, it creates this blast of dopamine that says, that felt really good, let's do it again. And again, and again, and again, and again. And that's the way our brains are designed. That's the way our brains work. We get dopamine from exercise. We get dopamine from eating an apple. We get dopamine from a lot of things in a lot of places. What makes it a substance use disorder is that it's extra. It's unregulated dopamine. So I think that's important to remember when talking to someone with a substance use disorder, that there is a neurochemical, biological thing happening in their brains. And that can take some of the sting, some of the pain, and some of the hurt out of our language when we talk to our loved ones. I would recommend using a lot of I statements. Use statements like, you did this, you don't love me, why are you doing this? That can feel really shaming and really hurtful. And the substance use, if you can kind of think of it as like another person, it wants to keep using. So it will take that you language and convince itself, then you don't love me, you don't understand. Therefore, I'm gonna go keep using. But when we flip the script and use that I language and talk about ourselves, I feel hurt when you yell at me while you're under the influence. I would really like to have this conversation when you're sober. That comes with so much more compassion, and it's focused on us and our experiences, and can take some of that sting out.
Well, one of the things that I hear immediately from the way you're describing this is that connection, is making sure that that connection still is there, that that bridge still exists, using those I statements. And I heard this in the way that you're describing it as well, is making sure that this individual knows that you still want to provide love and support. You want to provide that support for the healthy behaviors. You don't want to provide support for the unhealthy behaviors. So that, I think, is a huge distinction. And that connection piece is an amazing piece to just keep in mind, to keep remembering, and to know that it may take some time. It is working against how the brain is wired.
Mm-hmm.
That will always take some time. But with love, with persistence, you can do a lot of things.
Yeah, that's so true. Which I think is another myth, is that the person who uses substances is doing it on purpose. Is that there is this choice component. You're choosing to hurt me. But when we get to the later stages of a substance use disorder, into the moderate and severe, there becomes less of a choice. It's like always the person's choice to pick up for the first time. But after continued use, it becomes less of a choice and more of a compulsion, because the brain needs that dopamine. And that's what we call increased tolerance. It needs that substance to get that dopamine blast because it forgot how to provide that dopamine at a regulated level from our other activities, like exercise, eating healthy. That's not enough. The brain has been hardwired to thinking it needs that much dopamine from, and it can only get it from the substances.
So it sounds like treatment is going to look very interesting, and I think you mentioned before about the idea of a spectrum. It sounds like treatment is going to operate on a spectrum as well.
Absolutely, Chris. Treatment is a spectrum. In business, we have different levels of care. And those levels progress in intensity as someone's substance use progresses in intensity. So at a very base level, we have something like HERO, which is community outpatient therapy. That can look like individual therapy sessions, maybe family sessions, once a week, a couple times a month. That's the outpatient level. And that's really for somebody who is realizing that their substance use is starting to get out of control, but it's still manageable. There is awareness, and there is enough other coping skills that they have more of a choice to use those other coping skills and just need to be taught or processed through some of the underlying motivations of what they're coping with. with the substance. And then at the next level, we can have like an early intervention. And that's one of the things that Treehouse does. And that looks like maybe a group once a week for a short time, coupled with individual or family therapy. And that group may focus on psychoeducation of the substances and moving along the stages of change. And that's really for someone who may have a mild substance use disorder. Keep moving up the spectrum, then we have intensive outpatient, which is also something that Treehouse does. And this is when we're really getting into that moderate to severe substance use disorder. Consequences are adding up. There is less of a choice, more of a compulsion, and those levels are getting dangerous. That substance use is getting dangerous.
Well, I have to believe that the treatment is going to continue to elevate as some of those symptoms elevate as well.
Mm-hmm.
I actually saw we have another question, and hopefully it ties in, because this is a part that we can get onto for quite a long time.
I know. We want to get to some of these questions. So this one says, should recovery always involve family members, or is it an individual process?
I think this person might have been reading my mind, because one of the things that I caught as you were going up these levels was how much support a community can provide. And even looking at prevention as a community effort. But a family is nothing but a small community. And so involving a family, whatever that family may look like, is a huge potential component of recovery. If we rely on just an individual to try to work through all of the things that we've been describing, that is a hard task.
Mm-hmm. And the hard reality for family members to accept is we may be contributing, we may be triggering, we may be enabling the substance use disorder to continue. So when a family isn't involved and doesn't have the opportunity to look at themselves and take responsibility for their own part, you could be perpetuating a cycle, a system. So to answer the question, should a family member always be involved? I wouldn't say always or never. We want to leave room for the individual experience, because if a family member is not healthy enough themselves to be involved, then they might not be ready to be. If they're not ready to take that compassionate, if they're still really hurt, they may need to do their own individual work before coming back together. So I think that's a conversation for a person to have with a therapist, to understand what those triggers may be, how to cope with feeling triggered by a family, and then for a family member to also understand how they may be triggering and what their boundaries should be.
I think that's a great distinction. And I know I have spoken with several individuals on their own recovery journey, and they have found a chosen family. They have found their own recovery community that is not related to them biologically, but has become their family.
Mm-hmm.
And I think that's what, when we really do look at Recovery Month, and this year's theme for Recovery Month is recovery is for everyone, every person, every family, every community. This one gets me, and I can be a little cheesy sometimes, but I mean, I really do feel like if we can build those levels of support within a community, within a family, we are doing so much better. We may not always be able to, as you said, but there are so many people out there who want to support recovery, that finding that community is possible. And I know that it's something that, as we break down some of these myths, we are building an even better community. Changing the language will reduce stigma, will reduce some of the suffering. And I love that. Looks like we have another question. Ooh, we are getting them. I love
Yes,
it.
they're coming on in. Has the pandemic had an effect on active users or those in recovery?
Absolutely. Chris and I were just talking about this yesterday. Absolutely. While we don't have the exact statistics out there because we're still in the pandemic, we do know that there has been an increase in alcohol sales in the United States, which we can only assume that therefore is an increase in alcohol use disorder and coping with the stress of the pandemic with alcohol. We do know that there has been an increase in overdoses, opiate overdoses. Just yesterday, I got an email from the DEA, I believe, putting out a warning about fentanyl-laced pills on the streets. So we know that the substances are getting more dangerous throughout the pandemic, and that people may be getting more desperate for that substance, for that coping. In the later stages of a substance use disorder, it becomes very isolating, and using in isolation. A lot of people have been isolated this past year and a half.
Absolutely.
And coping with substances in that isolation, which is again why community and family support is that much more important, because recovery is a community. If substance use is isolation, recovery is community.
I love that. I definitely think, and I remember our conversation yesterday, we see those increases in numbers and it's like the tip of an iceberg. We know there's so much more underneath, and that's what propels us to help, because we know the need is there. And we have absolutely seen an uptick as kids have gone back to school, and that community of teachers and administrators has formed back around them and can see them, not just through a little box on the screen. So there's definitely been an uptick in this kind of challenge. But I do believe that there is also an uptick in the support and the help that we can bring to bear. So I think that leads us to, how do we help?
But before we get there, we've got a question. that
Another
just
question,
came
I
in.
love it.
Yes, yes. All right, Emily asked, how do you handle those that may be interested in treatment but are worried about legal involvement by admitting they use illegal substances?
That's a great question.
Do you want to explain 42 CFR Part 2?
Actually, I know you're much more practiced on that one. So I'll let you jump into that, and then I can add my pieces in terms of my professional ethics as a licensed professional counselor who is bound under those statutes.
Yes, so disclaimer, we are not attorneys, so we are not giving legal advice here, but that is a really good question. And I would encourage anybody who is piqued, whose interest is piqued by this discussion, to do their own research into the nitty-gritty ins and outs of the laws. For Georgia, there is an amnesty law when it comes to opiate use that says the person who has experienced an overdose and the person calling for medical attention will not get in legal trouble for seeking medical attention. Everybody else get out of there. But the person calling and the person in the overdose will not get in trouble. And that law came by, I believe, in like 2012. That's the Georgia amnesty law. And there is a great number of resources around that on the web to look into more in depth what that looks like.
And that is a great resource and a great piece of information for folks to have. In terms of treatment, what we are looking for and what ethics will bind me in particular as a licensed professional counselor is I'm looking at harm potential. So somebody who comes in looking for treatment to reduce their substance use doesn't mean I involve any kind of legal mechanism, because they are looking for help. I am going to help. And I think this is one of the things that we didn't get to highlighting in treatment is some of the differences between what's been called abstinence-only treatment and harm reduction treatment. And both can be very, very effective. My particular perspective here would be if somebody is coming in and looking for help, then I may not say, well, you have to be abstinent if I'm going to help you. I may just be looking to say, okay, how can we make some progress on what you're here for? And if that's reducing the risk, wonderful. If we can get that to abstinence, even more wonderful. But I want to continue to provide help, continue to provide support. And there are so many programs that work in that way as well. So I think if there are those that are struggling with substances and concerned that reaching out for help may be something that triggers the legal system, I don't want you to worry about that as much as I want you to look for help. I want you to just open the door, and that's going to be a huge step.
Yeah. That fear of the legal system, we don't want that to be a barrier to getting the help and support that someone needs. When it comes to treatment and seeking help through treatment, if it is a designated substance use treatment program, we're also bound by a federal law that is more strict than, you may know, HIPAA. It's more strict than HIPAA to protect a person seeking substance use treatment from the stigma, from discrimination and prejudice. And so again, that's a law called 42 CFR Part 2. And as the Treehouse is a designated substance use treatment program, we are bound by that federal law to protect the identity of our clients who are seeking support for their substance use disorder.
And I'm so glad that we have these provisions, these laws that will help us help those who need help. It's a lot of helps, but
Hey, sometimes we need a lot of help.
So, Chris and Jen, as we get ready to close, can you tell us a little bit about how Chris 180 can help people on their recovery journey?
Absolutely. So we have just highlighted 2 programs, the HERO program and Treehouse, but there are many other programs and services within Chris 180 that provide substance use support. For instance, we have the Fulton County Clubhouse that provides relapse prevention groups in psychoeducation. We have groups that run at our At Promise centers and Westside Empowerment Center. We have groups at our Chris Counseling Center DeKalb for adults called Present Mind Recovery. And then Chris 180 has a whole host of therapists within its system who specialize or are comfortable working with somebody who is at those beginning stages of their substance use and seeking those initial steps through individual therapy and family therapy.
it is always hard to highlight and specifically name every program we have here at Chris 180. But I know, being a part of this organization, that if somebody is looking for help, we will do what we can to find that help. And there are so many programs that I believe in many of the cases we can find the help and we can provide the help here. And we have relationships all across the city, all across the counties, all across the state. And we're, I think, all very committed to, if we can find help, we're going to find it.
Yes.
I think another thing that I know we want to highlight to support recovery is our upcoming recovery fair.
Absolutely. So we spent a lot of time talking about substance use disorder, what it looks like in treatment. But this month is all about recovery. And I say recovery starts the moment you seek help. The moment you decide to make that change in your life, you are on the recovery journey. And so recovery looks different for everyone. Another myth or stigma is that recovery is, the 12-step model of Alcoholics Anonymous, which is awesome, huge global community through 12 steps. There are so many other resources and recovery pathways that people are not aware of. Just to name a few: Smart Recovery, Recovery Dharma, Celebrate Recovery. And those are more like established pathways. But then here in Georgia, we have so many recovery community organizations, which are people living in recovery that come together and do life together. And those are awesome resources as well. And then we have some even non-traditional recovery pathways that people might not think of. Exercise can be a recovery pathway. Knitting sweaters can be a recovery pathway. Here, recovery can be synonymous with coping skills.
I am going to steal the do life, because whatever we can do to do life, we can build into a recovery and recovery community. And that's what we're going to be doing in part on Saturday.
Absolutely.
Is our recovery fair. We'll show some of these recovery pathways. It will give some ideas. It will be a celebration of recovery. And we're super excited to be able to provide it, to be able to be actually out in the wild, so to speak, in person, outside. And I'm very excited. It's going to be great.
Our recovery fair is going to be awesome. It's going to highlight Chris 180 and the different programs that we have here that support people in recovery, and as well as some community resources. It's really a time to get together as a community to break the stigma, to say that we acknowledge that people are struggling with substance use disorder, and we are here for you. And we are going to celebrate with some food and music, and just have a good time after, a year and a half of the difficulty and isolation of the pandemic.
Well, they said it best. We would love to see each of you here at our main office on Fayetteville Road in Atlanta. If you're watching on Instagram and you didn't see the slide that just went up, make sure you go to our Chris 180 Facebook page to get details about the recovery fair. If you know someone who's in recovery, or if you run a community organization that would like to know more about community and recovery programs, please join us this Saturday from 10 to 2 p.m. We'd love to have you. And we're glad that we were able to have this conversation today. As Chris and Jen both mentioned, behavioral health care is at the heart of what we do here at Chris 180. And that means also spreading the word about recovery and helping families who have been affected by substance use disorder. We want to continue those conversations. So if you need help, or if you need assistance in finding out what may work for you and your family or someone who you love, please reach out to Chris 180. You can contact us by calling us or going on our website, chris180.org, and our care team will reach out to you. Thank you again for being a part of this conversation. And remember, as we close out September, recovery truly is for everyone. We'll see you next month.